So I just wanted to come in here and talk a little bit about my experience with my first pregnancy. Earlier this year, well, actually last year, my husband and I decided we wanted to think about starting a family. So at my annual doctor's appointment, I talked to my doctor and, let her know that we were thinking about that. And she said, okay, I think it would be a really good time for you to start doing just like testing to just like make sure everything's good, make sure you have no issues. So it was really just simple blood work, and she had my husband come in and had him do blood work as well, just so we could make sure that we were all good and we had no concerns. So I started that blood work, I think like sometime last year at the end of the year, and my husband did as well. And then we went on vacation. We didn't really think about it, and my doctor had called me and asked me when we got back if I could come in for more testing. So I went in for more testing, and they actually told me that I had PCOS. So I had no idea what PCOS is. And for those of you who don't know, it means polycystic ovarian syndrome. So it means there's just like tiny little cysts on your ovaries, which can make it difficult for you to get pregnant. So there's some other symptoms with that. Some people have a lot more symptoms than others. For me, my only symptom of that was just irregular cycles. I really didn't have any of the excessive weight gain or really off levels that some people have. My levels were a little bit off, which is how they found out that I had it, but they said it could be more difficult for us to get pregnant. So immediately I'm just like, oh my goodness, okay, what next? So then my doctor said she wanted me to do additional testing. So I first started with a in-office saline ultrasound, where they use the catheter to shoot saline into your uterus and try and get it into your tubes to make sure everything looks good, so that your uterus looks good, your tubes look good, and everything like that. So I went in for that appointment sometime towards the end of January. And when I went in for that appointment, they said my uterus looked good, but my tubes looked like they were blocked. So my doctor recommended that I meet with another doctor in the practice who could do a HSG, which is, I can't pronounce the name of what the actual procedure is, but it's basically where you go into a hospital and, again, with a catheter, they shoot a fluid in there to look at your tubes and your uterus, but this time it's a dye rather than a saline solution, and the dye makes it so that you could take x-rays at the same time, and you could get pictures of the tubes to see if they are blocked, where they might be blocked. So I went into the hospital, and I was so nervous for this appointment because basically in my head I was thinking, oh my goodness, if my tubes are blocked, then that's it. Then I'm never going to be able to get pregnant, or you're going to have to move right to IVF. So I was really nervous, but and I was also really nervous because I heard this procedure hurts really bad, because if your tubes are blocked, basically they try to create a lot of pressure to push the tubes open, because sometimes they can actually be opened with this procedure. So I go in for the procedure, and the doctor comes in, and I can see everything on the screen. So he starts the procedure, and a few seconds later I see the dye go through the tubes and come out the other end. So one of them took a little bit longer, but the other one right away, it went through, and they were both open. So my husband was there with me, and we were just so excited that everything looked really good. So we went home and we're like, okay, great. So now it's just the PCOS we have to deal with. We don't have to deal with blocked tubes. So we were really happy about that. So this procedure, I had it done on February 8th. I remember the exact day because it was just a very traumatic day for me. So I had that done on February 8th. And then I was having a lot of symptoms after that, like a lot of pain, and just a lot of like, I thought maybe I was having my period again, and it was just strange because you get that test done right after you finish a cycle, so it was weird that that was happening again. So I called the doctor, told him my symptoms, and I was like, I'm really concerned. This isn't what you said would happen. And so when you call the doctor's office, they basically give you to a nurse, and the nurse was like, oh, everything's fine. And so I said, okay, and they said, if it gets worse, call. So the next day it was worse. So I called and I told them that it was worse and, I'd like to come in and see the doctor. They said, nope, it's still fine, don't worry about it. So the next day it was still getting a little bit worse, but I said, you know what, let me just wait and not call the doctor again. So then the next day I called the doctor again for a third time, and I said, I'd really like to come in because things are just getting a lot worse and I'm having a lot of pain and a lot of cramping. So I go in for an appointment and the doctor said, nope, everything looks great, everything's fine, it's just probably, the dye, bothered you, you had a reaction to it, but everything looks great. And I just did not feel good after that appointment. In my heart, I just knew something was still off. So I made an appointment with a fertility specialist because this was just at a regular, OB doctor, gynae practice. So I made an appointment with a fertility specialist and figured I would just go in and kind of tell that doctor everything that's been going on and just get a second opinion because I was just not feeling good with everything that was going on. And I just felt like overall it was just a lot in a very short time. And I went from just telling the doctor we were thinking about starting a family to you have PCOS to your tubes might be blocked to having this procedure and then having a lot of really not good symptoms. So I went to see the fertility specialist. They were able to get me in 1 week after I saw the doctor for my follow-up, but it was 2 weeks exactly after the procedure. So I had the procedure on the 8th, and then I saw the doctor, I believe it was like February 22nd. And so we had my first appointment where we just talked about everything that was going on with me, my history, my husband's history, and they said, you know what, we want to do some blood work, we want to do an ultrasound, we want to just see what's going on. So they were able to get me in for an ultrasound 2 days later. So this was Friday, February 24th. They were able to get me in for an ultrasound at 6:30 in the morning. And they had my husband come in that same day to do blood work. Since this was a new practice, they wanted us both to come in to just do blood work because if anything was wrong and we were ever going to do fertility treatment, there's a bunch of blood work you have to do. So they said, let's just get it all done. So we go in 6:30 in the morning, they take us both back for blood work, we do the blood work, and my husband had to get to work, but I was actually going to be working from home that day because my mom was in town. So after he left, I went back out to the waiting room, and then they called me back in to do my ultrasound. So I go in, and actually before I went in for the ultrasound, they make you pee in a cup to do a pregnancy test just because they always do it before an ultrasound. And so I do that, and then I go in for my ultrasound, and the ultrasound tech was just it was really long, and these are internal ultrasounds, so it was very uncomfortable, very painful, and so she's just like, I'm gonna be right back. And so she left me in the room by myself, and I'm just thinking to myself, oh my goodness, what is going on? So she leaves and she comes back in and she says to me, you're pregnant. And I was just for a second I was like, oh. But then she says, it's in your tube and your tube is starting to rupture. And I immediately started hysterically crying. I didn't even really know what this meant yet. I never even heard about a tubal pregnancy. But I just immediately started crying and was just like, oh my gosh, what is happening? And she said I was having so much bleeding because my tube was in the process of rupturing and I was bleeding into my pelvis. And she said to me, I want you to stay calm, but this is an emergency. She told me she wanted me to, get fully dressed and go out into the room. She's going to call the fertility doctor in, and we'll see what next steps will be. So I went into the waiting room and I immediately called my husband, and I was just like, oh my gosh, I don't know what's happening. She said I'm pregnant. This is an emergency, but I didn't know what it meant yet. So she comes back in and she said the doctor isn't in this office, they're in the other office. So she said, is there somebody who could come drive you and take you over there, because you should not be driving in this condition? And I'm like, what condition? Like, I didn't think anything was like so crazy. But I said, I only live like 5 minutes from here. I'll drive home and then my mom can drive me over. So they let me go home, and then my mom, and because it was 6:30 in the morning, I hadn't eaten yet, and she said to me, do not eat anything. And I'm just like, okay. So I literally had got up, took a shower, brushed my teeth, and went to the doctor. I didn't eat anything. I maybe had some water, and that was it. So I was just like, okay. So I get home, I tell my mom what was going on. My mom got ready really fast, and we went over to the office where the doctor was, and they did another ultrasound at that appointment, and she said, you are in the process of a tube rupturing. It's already started, and so we need to go in and surgically remove the pregnancy. She's like, you're 8 weeks pregnant, and we have to remove the pregnancy, and we probably need to remove your tube because there's already so much damage to it that if we keep the tube, then you are at a very high risk of this happening over and over again. And I just lost it. I was just like a mess. And thankfully my mom was in town and there with me, and it was just random that she was there. And we actually had plans later that day to go into Chicago and go shopping. But we had to cancel those plans. So the doctor, the fertility doctor, wasn't even actually able to do the schedule because she had a full day of patients, or she wasn't able to do the surgery because she had a full day of patients. So I actually had to go to another hospital. So her practice is actually in a hospital, but I had to go to a different hospital that my other office has privileges at. So because I was 8 weeks pregnant and I had this HSG done only 2 weeks ago, it was 2 weeks and 2 days, so it was 16 days ago, and this doctor did not see an ectopic pregnancy when he did a procedure, which is specifically to look at your tubes. I did not want that doctor to do this surgery. I didn't want that doctor anywhere near me. I never even wanted to see that doctor again, because if he would have known I was pregnant at that time of the HSG, then they could have figured out another way of, helping me through this without removing a tube and without a tube rupturing and without being to the point where I was basically starting to hemorrhage and starting to clot and in a really bad position. So basically I went over to this other hospital. My mom drove me over there. My husband left work and he met me there, and we went in through the emergency room. They took me right into the room, and as soon as we got in there, they put the IVs in. They had us they had the doctor who was on call come in, which is another doctor from that same practice that the doctor who I had the HSG with, but this is a brand new doctor who was specifically OB type stuff, and he had done these surgeries in the past. So he came in and he kind of talked to me about the options. And his options were basically either I take this medicine, which is actually a cancer medication that will basically, the medication dissolves the pregnancy, and it's like a very painful medication that you can take, or have the surgery to remove the tube. And he said if I take the medicine, then it might not completely get all the tissue out from the pregnancy, and I still might need the surgery. And I immediately said, I'm just a little confused, because the fertility doctor, who I just immediately had a really great connection with, she basically was like, you need your tube out immediately. You are starting to hemorrhage. And she's like, this needs to happen within 2 hours. But then this doctor is saying I could just take a medication. And I was just like, it just feels like very opposite sides. So he said, you know what, I'm going to be right back. I'm going to go call the doctor and see, what we're working with. So he came back after calling her and he said, I agree with her. She showed me the ultrasound pictures. He's like, we need to do the surgery. So they immediately got me prepped and ready for surgery. So I'm telling you, I went in at 6:30 in the morning for that first ultrasound. I think I went in for surgery maybe around like 1 o'clock. I was out of the hospital that day by like 7. So everything was just like boom, 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 super quick. And it was just like crazy. I just like was so emotional, and it was horrible. So it was just a really, really hard experience. I went from, again, just doing this like testing just to make sure everything was okay to actually getting pregnant, like the very first time we tried, which my doctor at the time basically told me that was not possible, that it was going to take us months and months and months. But the very first time we tried, because we were like, all right, we'll start trying because we don't know what's going to happen, I actually got pregnant the very first time, which I was just shocked. And so I got pregnant the first time, but it ended up being in my tube. And I never knew I was pregnant. I kept telling my sister, I was like, it just feels weird. Something feels weird. But I wasn't really taking pregnancy tests because I was just so in my head that this was not going to happen for us until we did these tests and saw what was going on. And each time I had a test, they did a pregnancy test before. And also when he looked at my tubes, how he didn't see it, I have no idea. It's just mind-boggling to me, even still to this day, and it is months and months later. So it was a really, really hard experience, but thankfully my mom, she stayed in town, and my mom left. That surgery was on Friday. My mom left on Monday, and the same day my sister flew in and stayed with us for 6 months. So I had family here and my husband, and I just had really supportive friends and family, because anyone who knows, who goes through any type of experience like this or any other type of loss, it's really difficult. So that is basically what happened. It was very traumatic, and now that I am pregnant again, I'm even more just like so nervous about everything, and I just have so much anxiety about everything with pregnancy, and I just can't wait until February is here and the baby is here, because I just get so nervous about everything. But I have since left that practice, that very first practice that I had all these tests on, and they told me this and told me that. I have since left that practice, and I have a new doctor, and I worked with that fertility specialist. I ended up needing fertility treatment, which I will talk about that in a separate video about the treatment and how that went in my experience. But I loved, loved, loved my fertility doctor. She is the one who found the ectopic. She then is the one who helped us get pregnant, and she was amazing. I have never had a doctor hug me, and she hugged me the day of the surgery, my follow-up appointment, the day I left the fertility clinic, because I was, 10 weeks pregnant and didn't need to be at the clinic anymore. But she was amazing, and she just made me feel like a person and not just like another patient coming in, and she helped me through a really, really difficult time. So it was a really difficult experience, but I'm really thankful that I had, really supportive people and really supportive doctors after leaving that one practice, to help me get through it. So I just wanted to share this because I had never even heard of an ectopic pregnancy ever in my life. I guess I just was the type of person who just sees what happened on TV and think that's life, but it's not. And a lot of people deal with loss. A lot of people deal with miscarriage. A lot of people deal with a lot of different things in pregnancy. Ectopic pregnancies are super, 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 super rare. It doesn't happen to a lot of people, but it happened to me. So now we're pregnant with our rainbow baby, and we are so excited. So I'm going to end this video here, but I just wanted to share my experience with that, because I think it's important that people know about these types of things, and also that you are an advocate for yourself. If you think something is wrong, maybe get a second opinion, or keep pushing until your doctor takes a look. And if nothing's wrong, then great, but it's better. I can't even imagine what would happen if I didn't go in to the doctor, because one of the leading causes of death in pregnancy is ectopic pregnancies that aren't diagnosed and treated soon enough. So if a tube ruptures, it can cause death. So thank God I got a second opinion and I went to that doctor, that fertility doctor, who was amazing. But anyways, I'll end this here. So thank you, everyone.